Neurofibromatosis is a genetic disorder where tumors form on the brain, spinal cord, and nerves. These tumors are usually non-cancerous but can turn cancerous occasionally. There are three types of neurofibromatosis: NF1, NF2, and schwannomatosis. NF1 affects 1 in 3,000 people and is caused by a mutation in the neurofibromin gene. Symptoms are noticed around time of birth and include bone deformities, benign tumors, learning disabilities, and larger head size. NF2 affects 1 in 25,000 people and is caused by mutations in the Merlin gene. Symptoms show up during early adult years as a result of benign tumors in the ears and cause hearing loss and poor balance. Lastly, schwannomatosis is the rarest type and affects 1 in 40,000 people. It is caused by mutations on the SMARCB1 and LZTR1 genes. Symptoms are noticed around age 25 to 30 as a result of tumors on cranial and spinal nerve and result in pain and chronic numbness, and weakness. Although there is not a cure, symptoms can be managed and life expectancy is close to normal. As for the treatment, zolimitinib is a medication that can treat benign tumors along nerves. If tumors are compressing nearby tissues or organs, surgery is needed to remove the tumors. Stereotactic radiosurgery is also an option where radiation can precisely be delivered to tumors. And lastly, pain medication can be used for schwannomatosis.
Since neurofibromatosis 1 is the most common form of the disease, we will cover the specific pathway in NF1. RAS is a protein that controls cell growth and proliferation. The NF1 gene encodes for the tumor suppressor protein, neurofibromin, which is a RAS GTPase activating protein. These proteins convert the active RAS GTP to the inactive RAS GDP. Doing so inhibits the downstream RAS signaling and thus keeps the cell growth in check. Growth factors interact with the receptors on the cell surface, which trigger guanine nucleotide exchange factors to activate the RAS protein by catalyzing release of GDP. After GDP is released, GTP quickly binds to the RAS protein. Now the RAS protein is activated, several other proteins bind to RAS and signal pathways are induced. RAS is not always on, and as previously mentioned, neurofibromin is a RAS GTPase activating protein that helps convert RAS GTP back to RAS GDP with the removal of a phosphate group. Individuals who have a mutated NF1 gene do not produce neurofibromin. All those key signaling pathways previously mentioned result in cell growth. Without neurofibromin, RAS GTP stays activated and cells will continue growing and dividing without control.
Currently, researchers are researching additional genes and molecular pathways that could contribute to the NF tumors. They are researching how the growth regulators control the reason and location for tumors. Researchers are trying to understand how genetic defects can cause the diverse range of symptoms encountered by NF patients. There is currently a lot of research surrounding MEK inhibitors, which are drugs that block the enzyme mitogen-activated protein kinase. They show promise in treating NF1 tumors since they affect how cells grow and develop. NF2 tumors are harder to treat, and therefore, certain viruses are being developed to help kill tumor cells. Most current drugs are targeted at killing tumor cells. However, the MEK inhibitors work by blocking the overactive RAS signaling pathway that causes tumor growth.